Welcome to another Selective Wealth Management video. In today's video, we're going to be covering Medicare Part A. Now, Medicare has multiple parts, and today's video only covers Medicare Part A. And we're going to be looking at three specific aspects, which are enrollment, cost, and coverage. So without further ado, let's dive in. So we'll begin with defining Medicare Part A and what it covers. Medicare Part A primarily covers inpatient hospital care, but it also covers skilled nursing facilities, at-home care, lab tests, hospice, and a couple of other items. We're going to focus on that inpatient hospital care because it's the largest item and one that you're most likely going to require a claim for. Inpatient hospital care is a bit of a nuanced definition. We'll say it involves the patient being admitted to the hospital for treatment and provided with lodging and food for the duration of their stay. It's quite a mouthful when you could just say it's anytime you stay overnight at a hospital. The issue with that is that's not 100% correct when you talk about overnight stays. The reason for this is, let's say you got injured at midnight, you went in for a surgery, you were there overnight in your mind and by pretty much all standards of how we keep track of time, but you're discharged at, let's say, 7 in the morning. That would not actually count as inpatient care because you weren't provided lodging. You actually had an outpatient medical event that just happened to happen late at night. And so if you're in and out of the hospital, that's outpatient hospital care. Inpatient hospital care is when you're provided lodging. That being said, you really can think of this as staying at the hospital overnight, particularly if you're given a bed and you're staying there. So that's what Medicare Part A covers. Let's talk a little bit about the cost, which is pretty simple. Medicare Part A for 99% of the plan participants has no monthly premium. And so you have no charges when you enroll for Medicare Part A. It's really important because that actually impacts our enrollment strategy. Now, there are 3 times that you can enroll for Medicare Part A. The first is the initial enrollment period. The initial enrollment period begins 3 months before you turn 65 and lasts until 3 months after you turn 65. And it includes the month that you do turn 65. So it's 7 months total, 3 before, the month you turn 65, and 3 months after. In general, enrolling in Medicare Part A, because it has no cost, many people think they should enroll right away. However, if you're covered under an employer plan and you have an HSA available to you because you have a high deductible health plan, you would lose the opportunity to invest into your HSA account by enrolling in Medicare Part A. So even though it has no cost, you still have to weigh the benefit of whether or not losing your HSA contributions is worth it. HSA contributions have immediate tax savings. They also have long-term tax savings by compounding tax-free. Then you can pull them out without paying taxes. So you'd be losing this known benefit of tax savings by no longer being eligible for an HSA. If you're not eligible for an HSA, then enrolling in Medicare Part A may make good sense because you are not paying anything for the plan. So you may as well enroll during the initial enrollment period, even if you're covered under an employer plan. If you wait until 3 months after you turn 65, your initial enrollment period has ended. For many people, they still are going to have the option to enroll during the special enrollment period. The special enrollment period can be triggered by a wide variety of situations, but the most common one is if you have a job that provides you health insurance coverage. A lot of people ask, hey, I'm working and I missed my initial enrollment period. Am I going to have to pay a penalty, a late penalty, for enrolling in Medicare? If you're still working and you're covered by your employer plan, the answer is no. You can apply during the special enrollment period. The special enrollment period, it starts when your initial enrollment period ends. So if you're still working and you miss the initial enrollment period, you can immediately apply for the special enrollment period. And this special enrollment period ends 8 months after your employment or coverage ends, whichever one of these two sooner. So your employment or the coverage ending, whichever of those comes first. You have 8 months from that trigger to enroll during the special enrollment period. Most people are going to enroll during the initial enrollment period because there's no cost. If you miss that and you're employed, enroll during the special enrollment period. If you miss both of these, so you've been retired and it's been more than 8 months, you may have to apply during the general enrollment period. This is between January 1st and March 31st every year. And your coverage starts the month after you sign up. However, if you miss the initial and special enrollment period, there is a chance that you may have to pay a penalty for late enrollment. So you're going to be looking out for these initial enrollment and special enrollment periods for Medicare Part A, and you want to do it as soon as practical if there's no cost associated to you, which for 99% of the people, that is true. Okay, so what is the coverage and out-of-pocket costs for my Medicare Part A? What does it actually cover? So we'll get down here to dollars and cents. There are two items you're going to be responsible for out-of-pocket costs for your Medicare Part A. The first is your deductible. So for 2024, the deductible is set at $1,632 for each benefit period. What this means is when you have a medical event that qualifies under Medicare Part A, you are on the hook for the first $1,632. You're going to pay that out of pocket first. Once you hit your deductible, any expenses beyond that are going to be covered by Medicare. Now, you may have what are known as co-insurance payments. For Medicare Part A, your co-insurance, or something you owe beyond your deductible, is quite complicated, but I will say it's rare that you're going to make a co-insurance payment. So in general, this $1,632 is the most that you're going to pay out of pocket for a medical event in a single benefit period. We are going to take a look at co-insurance and see when does this kick in and why might it make sense to have a supplemental health insurance plan for your Medicare Part A coverage. So with that, let's go ahead and move down to the calculator. All right, the first thing that we're going to look at in this calculator are when enrollment periods start. The first enrollment period is the initial enrollment window, which we had chatted about. This period, again, starts 3 months before you turn 65, lasts 3 months after for a total of 7 months. If you're curious about your enrollment window, you can actually just type in your date of birth here. I'll type in a random date, let's say April 1st, 1967. When you type that in, this will show you when your initial enrollment period starts. So actually, I'm going to change this to April 7th, so that's a little bit more interesting. So let's make that April 7th. You'll notice that if I turn 65 on April 7th, that my initial enrollment window actually starts 3 months prior to that on the first of the month. So January 1st, 3 months prior to April, the year that I turned 65, my initial enrollment starts. My initial enrollment ends 3 months after the month that I turned 65. And you can see that's at the end of the month in July. So you get from the 1st for the beginning of it, and you get till the 31st for the end of the window. So this is the initial enrollment window. And in general, it does make sense to apply for Medicare Part A during this window because there's no cost associated for most plan participants. If you're still working during this initial enrollment window and for some reason you miss it or you don't want to apply, you just want to apply one time after you finish working, we'll scroll down here and take a look at the special enrollment window. Now, special enrollment window can get kicked off for many reasons, as we had mentioned. We're only going to talk about if you're still working because it's the most common. So let's say that I plan on retiring, let's see, when I am 60, let's see, that's 65. So we'll say when I'm 68, so it'd be 2035. So I'm going to work till I'm 68 years old. Here you can see when the special enrollment starts based on that target retirement date. Now for that retirement date, you can put in the day you actually retired, and it will show you the special enrollment window, or the day you plan to retire. So in this instance, I put in the date that I plan to retire, 2035. Special enrollment starts one day after your initial enrollment ends. So you can see here, this went till July 31st, 2032. This started the very next day. So if you miss that initial enrollment window and you're still working and you say, hey, I do want to apply for Medicare Part A because it doesn't cost anything, you are in your special enrollment window while you're working. So you can go ahead and apply. If you do retire here in July 15th, your special enrollment window is going to end 8 months after your retirement date there. It's actually your retirement date or the last day of your health insurance coverage, whichever occurs first. They usually coincide. So this is actually should be the date of retirement or the day that your health insurance coverage stops, whichever is sooner. I'll update that. So yeah, you have until the special enrollment period ends 8 months after your date of retirement. Now, what does Medicare Part A cover? Medicare Part A, as we had mentioned, we're going to take a look at the out-of-pocket costs for what this actually covers. For inpatient hospital care, when you have an overnight stay in the hospital, there are two things that are going to determine your medical bill. This is highly simplified, but it illustrates the point quite well. The first number you need is your average daily cost of your hospital stay and the number of days you're in the hospital. This will give you your total medical bill as if you had no health insurance. Now, the average daily cost of a hospital stay in the United States is highly variable, depending on things like geography and many other factors. We're going to use this average of $3,200 per day to illustrate our point. Your medical bill could be very different from this, but the calculator still works. You could just type in whatever the daily cost is for a hospital stay. So with that number, we're going to take a look at a medical event. Let's say, hypothetically, I was covered under Medicare Part A, and I have a medical event, and we're going to say that it starts today, which is April 12th, 2024, and I have 1 day in the hospital. What you'll see here on the right-hand side is how much you pay for this medical event and how much Medicare pays. So in this instance, I was in the hospital for 1 day. My total bill was $3,200 times 1 day, which is $3,200. I paid $1,632 of this, and Medicare paid the rest. If you add these two numbers, it equals the total medical bill. This $1,632 number is my deductible. So I have to pay that first out of pocket before Medicare kicks in. Once I pay my deductible, Medicare pays the rest. I have 0% coinsurance. That is phenomenal coverage. So if I increment this up, what you'll see is that my out-of-pocket cost is the same. It's still just the deductible, and Medicare paid the rest. It picked up the entire $3,200 for my second day in the hospital. This 0% coinsurance, where you don't pay anything, and Medicare picks up the rest, is true for your first 60 days for a single benefit period. I'm going to go ahead and increment this up. You'll see you still have no increase in your out-of-pocket because Medicare pays the rest. If I type in 60 days here, so you were in inpatient hospital care for 60 days, your bill doesn't change at all. You just pay the deductible and Medicare pays the rest. And as you can see, if you have a 60-day hospital visit, it's a very good thing that Medicare paid the rest because the bill is quite large. Now, when you hit 60 days, this is a break point in Medicare Part A. At day 61, you have to pitch in coinsurance. The amount you pay is $408 per day. So if I increment this up 1, this will go up $408. So I go up 1, you can see you now paid $2,040, which is $408 more than your deductible. Medicare paid the rest. This is true every day between days 60 and 90. So if I increment this up again by 1, this goes up $408 again. And that will continue until I get to day 90. At day 90, you can see my out-of-pocket cost of $13,872 is starting to get substantial. That $408 coinsurance that kicked in at day 60 starts to really pick up between days 60 and 90. Now, when you hit day 90, two things happen for your Medicare Part A coverage. The first is your coinsurance amount changes. You now pay $816 per day. These numbers, by the way, are all for 2024. So if I increment this up by 1, you'll see this increases $816. And Medicare pays the rest. So your coinsurance amount has doubled. This is true from days 90 till day 150. The second thing that happened is I'm going to go ahead and increment this back down. You can see here you have 60 lifetime reserve days. Now, lifetime reserve days is beyond the scope of this video. We're going to cover that in a separate video. But for this video, all you need to know is that when you go past 90 days in the hospital in a single benefit period, every day past 90, you use up a lifetime reserve day. When those lifetime reserve days run out, your Medicare Part A stops for visits past 90 days. We're not going to go into all the nuance of that, but I'll show you real quickly here. So every day you're in the hospital past 90, your lifetime reserve days drops. So I incremented this up by 3. You went from 60 lifetime reserve days down to 57. So not only did your coinsurance double, but you're using up lifetime reserve days. When you get to 150, you're out of lifetime reserve days. That's the 90 days plus your 60 lifetime reserve. When you hit 150 days in a single benefit period and you are out of lifetime reserve days, every day you're in the hospital past that, you pay 100% of it. Your coinsurance is 100%. So if I increment this up one day, you're going to see what you pay out of pocket here goes up $3,200. So if you're in the hospital for 180 days, that hospital bill can get very large. So that is how Medicare Part A works for coinsurance payments from days 0 to 60. You pay your deductible, and Medicare pays everything after that. From days 60 to 90, you pay $408 per day. And then from days 90 to 150, you pay $816 a day for a single benefit period. There's nuance to the last one, but that is generally how it works. Now, you can see a very large medical bill here for inpatient hospital care lasting 180 days. It's important to note that it's extremely rare that you would be in the hospital for 180 days consecutively, or even inside a single benefit period. The average inpatient hospital care for people that are over the age of 60 is between 4 and 5 days if they have a severe medical event. So if I change this back to 4, you can see we're way within the window, that 60-day window. The second thing that I want to add here is that if you have a really traumatic medical event, such as a coma, comas in general may last a few weeks, but these are some of the longest inpatient hospital care medical events that occur. You're still well within that 60-day window. So the 60 days where you're fully covered is actually phenomenal coverage, and it would be extremely rare that you go past that. Going between 60 and 90 is even longer, and you just have that coinsurance of $408. These really long days in hospital of over 150 would be incredibly rare, and I don't think it's a cause for concern. Medicare Part A is phenomenal coverage. Now, one thing I should add, let's type in 180 again to take a look at this large medical bill here. Most Medicare supplement policies will provide coverage for these types of medical events, and so it may be worthwhile to look into that, not just for Medicare Part A, but also Medicare Part B. So that's it for our content on Medicare Part A. This represents one planning opportunity out of hundreds that we check for our clients here at Selective Wealth Management. If you're interested in becoming a client or would like a free consultation, visit our website at www.selectivewealthmanagement.com and book your free consultation today. Thanks.